Acting Queens Borough President Sharon, thank you so much for joining us on ITV Gold. It is so great to have you here.
It's my absolute pleasure. Thank you for having me.
You know, we were waiting to get somebody from Queens to come and talk to us about what is happening in what we're calling the epicenter of COVID-19 crisis.
Yeah.
And it is actually really wonderful to have you to be able to discuss some resources and perhaps for you to reach out to our immigrant community. So just beginning this interview right now, if you could address our immigrant community onto what's happening with COVID-19 crisis right now and how the borough's office has truly handled the situation, that'd be great.
Of course. Well, Ms. Lamba, thank you again for having me. You're right. This is the epicenter of the epicenter. It is an unenviable marker. Trust me, it is. That is not a contest that anyone wants to be a part of.
Yeah.
And you know what's been interesting is that the virus itself may not discriminate. Right? It hits people of all ages, evidently now, not just older, but also children and babies. It reaches people of all, races, ethnicities, regardless of where it hits everybody. And while the virus itself may not discriminate, what the pandemic has done is it has exposed and it has amplified a lot of the inequities and the deficiencies in access to care and resources and safety. And so when we talk about how hard certain areas of the nation, certain areas of New York, certain areas of our borough have been hit, it's not because the virus they're necessarily more susceptible to the virus. It's really a product or the result of already existing inequities and deficiencies. We talk about underlying conditions. It has exposed some of the underlying conditions in terms of services and access. So we've been working around the clock, and everywhere around the borough, you are seeing, some of the worst, right? We've got some unscrupulous folks trying to capitalize on life and death, trying to take advantage of people at their most vulnerable, consumer fraud, and these are things that law enforcement and leaders are keeping a close eye on and trying to make sure that in partnership with folks like ITV to get the truth out there that no, there's not one pill that can, solve, it can cure you, or, you don't have to pay for a COVID test, right? So what's truth and what's not truth? That I think is something that is critically needed. But what the pandemic has also amplified is some of the best. We've seen people really step up, people being so selfless, putting themselves and their lives on the line to help people, moving mountains with whatever resources are available. And also it's reminded us what is essential, right? When we talk about who is essential in our society, and yes, it's the frontline workers, like the hospital workers and firefighters and EMS and our police officers. It's also the grocery store clerks, the ones who are stocking the shelves, because, I don't know about you, but every time you go into a bodega or if you go into a grocery store in the last several weeks, when you see shelves empty, that's not a good feeling, and that's not something good to see, right? People are making deliveries without whom, it's just to seniors and homebound elders, without whom our society just wouldn't function. We just wouldn't be able to survive. So this has really magnified who is essential, whose work we should really value and bring up to speed in terms of resources.
What have been some of your challenges
yeah.
in terms with, the hospital management, to getting the PPE supplies, to also catering to the racial disparity that we see in Queens, especially being the epicenter? Talk to us about some of those.
Right. It depends on where you're looking, right? So 2 months ago, a lot of the challenges were having people shelter in place, stay at home. But fact of the matter is, in Queens, even if you stay at home, you can't isolate. You cannot isolate, right? We have 3, 4, 5 families living in 2-bedroom apartments.
Right.
You cannot isolate even if you want to, even if you are staying at home. And so conditions like that, shortages in housing, affordability, all of those underlying conditions that we talked about earlier, that really accelerated, I think, the spread of COVID in the initial weeks. Some of the challenges also were the supply chains that we were seeing for PPEs and other kinds of supplies, a global supply run that was happening around the globe where countries and states were competing against one another. And that was very challenging because, we're in the United States of America. And the challenges that we were seeing, it didn't seem to fit. It shouldn't be happening here. We should be able to take care of people. We should be able to keep up with the tide. But for a while, it was really difficult. Now we're starting to bend that curve on multiple fold. But the other challenge right now is to make sure that people do not have a false sense of security and stay vigilant about social distancing. The weather is getting warmer. People have been cooped up for a while. Children are still at home, right? And so everyone is eager to get outside. But we have to remember that this is a virus. The effect of the virus, you don't see immediately, right? So you can take on a false sense of security, and it's important to stay vigilant. Keep your mask on, wash your hands regularly, frequently, wear gloves if you can. So all these things we have to remain vigilant for the foreseeable future. The pandemic has been multifold. This has been a war. This is a war. This is a war against a virus, and it's a health crisis coupled with an economic crisis. Right now the unemployment rate has been reaching record highs, not seen since the Great Depression, a century ago. And every day that goes by, every single day that goes by, we are accelerating toward a deeper and deepening economic crisis. But the reopening of Queens and the city of New York is a very delicate one.
Yeah.
Very, very delicate, because it will cost lives if we do it carelessly, recklessly, too soon. And it's not just about lives, it's about which lives. And New York, we don't accept that any lives are expendable. But as we've seen in this pandemic, a lot of lives are disproportionately impacted. The cost of the inequities are disproportionately felt and suffered by certain communities, not because of the virus, but because of our underlying conditions.
Interesting. When you say the economic downfall, I kind of want to talk to you about this because this is the question of the entire nation, perhaps.
Yeah.
What is going to happen to the American economy? But perhaps all of us that are here in New York City, that's even a bigger question because we are still practically shut down. And it is important for us to, sustain that for a while. What is happening in the borough's office in terms of getting that economic stability back in order? And what is your focus in terms of that?
It's been multifold. For one example, we've been doing periodic job fairs or virtual job recruitment fairs. We held 2 already, and the next one will be June 3rd. And I will tell you, Ms. Lamba, the first one on April 22nd, we had an RSVP count of a little over 600. And then the last one, which was last Wednesday, an RSVP count of over 900, just within a span of 3 weeks. And so that could be by virtue of more people knowing about the job fair, but I think it's more a reflection of the need and where we are. The pandemic has been devastating the workforce and the economy, and it's unsustainable. But again, we have to be very delicate about how we reopen. And so it's a really tricky situation, and it's a moving target, and it's inconvenient for many, but I'd rather have an inconvenience than life or death. So job fair, a couple of job fairs is one of them. We've had to be a little creative. One thing that we launched back in March, and it's still in the last tail end of the initiative, it's called Fuel the Front Lines. And the thought was we raise funds and the monies go towards small businesses here in Queens. We're known for our restaurants. We're known for our entrepreneurs. And what's the best way to help businesses? Give them work. So we were fueling funds raised to local businesses, entrepreneurs. They in turn would create individually packaged meals to the tune of hundreds a day. And then those would actually be delivered same day, freshly made, amazing food, by the way. And those would be delivered to the front lines. So across 9 hospitals here in Queens, we have 9, across all 9 hospitals, some of the EMS stations, some of the bus depots. So that's been going on for several weeks. We were able to raise a little over $88,000 in the first month. And it's been sustaining. And all of those monies went directly to local businesses. And so it was a double whammy, right? We're fueling the small businesses, and we're not going to save the small businesses with $88,000, but it's a matter of keeping them afloat, helping them as long as we can, as this tide comes. And then also make sure that our frontline workers who are working around the clock are being fed with nutritious, freshly packaged meals. So, things like that. I think initiatives, we have to be very creative, especially looking forward to the road of recovery ahead. The city and the state have been hit hard with the revenue hits, and that's going to really impact our services in the near future, in the next 6, 12, 18 months. But that's going to be very critical because that's our road to recovery. So we're going to have to be very creative and innovative in ways that were not demanded of us for a while, right? Pre-COVID, the economy was doing pretty well. And so we're going to have to be very creative, innovative, and focus on those who need.
Definitely. From economic, let's talk about these people that need help and also the healthcare system. My first question to you would be, the healthcare crisis is kind of going hand in hand with the economic crisis here. What is your take on that and the impact it has had on hospitals, especially in Queens? And are we seeing a better condition now, a better situation now because the cases are slowing down or the curve is bending?
I'm hearing at the hospitals that things are getting better, but again, it's kind of cautious, right? And there's also a lot of cost to this that we're still going to have to work through beyond the immediate triage, right? There's a lot of trauma that's happened, and it's going to come out. I was at Queens Hospital a few weeks ago, and each hospital, they have their own sort of routine whenever there's a COVID patient who's being discharged to go home. It's a celebratory thing. And remember, 2 months ago, that wasn't happening very often. And so just 2-3 weeks ago, I was at Queens Hospital and, checking out how things were doing. And suddenly one of the folks who were with me from the hospital, they had this like pager-like device, and it was playing "Here Comes the Sun" by the Beatles. So apparently at Queens Hospital, when you hear that, that means there's a patient, a COVID positive patient who has recovered enough to be discharged to go home. And so when anybody hears that tune in the hospital, they go running toward the lobby, right, awaiting for the patient to be discharged. And they line up like a parade and they're ready to cheer. And so I was like, can I join? They're like, sure. So we were all standing there, and one of the senior staff members at the hospital, we were chit-chatting while we were waiting for this patient. And she said, there was a nurse the day prior for that sort of routine. And when someone was being discharged, the nurse just broke down crying. And I said, why? And the senior official said, well, for so long, this nurse kept seeing body after body after body leaving in bags. And the only sound that you would hear chronically was coding. And so when that nurse finally saw someone leaving to go home, that's when she broke, right? So trauma is going to come out in different ways, and especially for our frontline workers, but also all over the borough in so many different ways. This is a pandemic that has been long lasting, and it's reaching people and hitting people in so many ways. Another example, domestic violence survivors, and people who are vulnerable, seniors, elders, children, staying at home and not having sort of the respite of being able to go to school or go to your work, go to church, what have you, and having to stay at home and being trapped. And so in the initial weeks of the pandemic, there were no calls, but now we are starting to see a rise in the calls of domestic violence and assault. And so those are things that we're going to have to really work through because the pandemic is not over. We are still very much in it. And if the experts are right, if there is another wave that is on the horizon, hopefully we'll be able to stave it off if we're all disciplined. But if there is another wave, we have to be prepared in terms of how we can reach people who are trapped, how we can reach people who are in need, who don't have family or folks who are able to take care of them.
Definitely. I have you for very last minutes now, but I want to touch upon something that's very important, and I think it's essential for us Asian communities to definitely partake in this, the census, and also voter education. If you could just reflect on the importance of filling out our census for this year, and also to go out and understand how we can vote during this time period. What are the precautions we can take, and also what are the resources that are available? I would love for us to end the interview on that.
Time flies when you're enjoying it. So thank you for making this so painless. By the way, I didn't realize the time went by so quickly. Well, also happy Asian American and Pacific Islander Heritage Month. Yes. It's been, it's hard to do what we normally would do, right? I think for our viewers here today, whether online or on TV, I'd like to urge you, I know there's a lot going on, but there are two priorities as we recover that are tantamount to our futures and our lives. And that's number one, being counted in the census. It only happens every 10 years. And frankly, if you don't count, you just don't matter. We're not visible. We are rendered invisible if we are not counted in the census. And the census actually determines the resources that we get. It determines our representation in government, in Congress, but it also determines how much we get. And going back to the disproportionate cost of the virus and the underlying conditions that we were talking about in our society, a lot of that stems from the underlying conditions of lack of resources. So Queens, we are the biggest borough by landmass. We are the second biggest by population, 2.34 million residents call Queens home. And they come from all over the world. Some of them came yesterday. Some of them are seventh generation. But when you look at even before the pandemic, even before COVID-19, we were the most underbedded borough in the city of New York, meaning hospital beds. We had the least number of hospital beds per capita before the pandemic. And so it wasn't terribly surprising when we were hit so hard by the pandemic. When we look at our elders, our seniors, when you look at the New York City senior population, a third of New York elders call Queens home. However, we get the least amount of dollars per senior than any other borough. And then also in our schools. The New York City school population, a third of the population calls Queens home. And yet, the city spends the least amount of public dollars per pupil for Queens than any other borough. That means the city spends less on a Queens kid than a Bronx kid, a Brooklyn kid, Manhattan kid, Staten Island kid. So going back to the census, we have to be counted. We have to be visible. We have to matter. And the census only takes 10 minutes. You can probably do it over the time that we've been here today. It's my2020census.gov. It takes 10 minutes of your time. It is so critical. And the second thing I would urge everyone to remember, of course, is to vote. If you are a resident of the city of New York, and if you are a registered voter, you are eligible for an absentee ballot. So you can vote, and you can vote safely. And so I urge you to fill out your absentee ballot application online. It takes 2 minutes. nycabsentee.com. nycabsentee.com. It takes 2 minutes to apply for your absentee ballot. And the reason why I urge you to apply for your absentee ballot, even if you decide to vote in person next month, we don't know what tomorrow is going to bring. Yeah. We don't know in a couple of weeks whether poll sites will still be open. But you'll think of that absentee ballot as almost like an insurance to make sure that we vote. And, COVID-19 has taken so much from us in terms of lives, in terms of our normalcy, in terms of everything that we knew as normal. Let us not allow COVID-19 to beat us into silence and to render us invisible. And so think of filling out your census and voting as your way to fight against this virus.
Yes, definitely. That's so important to advocate your voice. And I appreciate you for giving our audience that time. Thank you so much for your time on ITV Gold.